Hello everyone, myself Vaishali Vishwakarma. I am a student of PG Diploma in Nutrition and Dietetics in Government Home Science College, Jabalpur. I am giving presentation on tuberculosis. So first we have to understand what is tuberculosis or TB in short. So in first part I am going to tell you about TB and why there is a need to learn about it, what causes TB, how it spreads, then different cases of TB, its classification, what are the symptoms and how it can be diagnosed, what measures we can take to prevent it and its treatment, and in the second part I am going to tell you about its dietary management. TB is an infectious disease, which means it spreads from an infected person to a healthy person. It is one of the leading cause of morbidity and mortality among adult population in India, and it is estimated that about 2 billion people worldwide are infected with Mycobacterium tuberculosis. So we can reduce mortality rate and eradicate TB infections by setting up an organized system for recognizing the infection, treating it, and we can aware people and reduce transmission from person to person. TB mostly affect lungs, but it can also affect other organs such as lymph nodes, intestine, brain, bones and joints, skin, etc. An organism that causes tuberculosis is Mycobacterium tuberculosis. It is a gram-positive, non-motile rod-shaped bacteria. It is an obligate aerobe, that is, it requires oxygen for its survival, and it has a lipid-rich cell wall that contains mycolic acid. Then how TB spreads? It spreads from one person to another through air. When a person with TB of lung or throat coughs, sneezes, sings or talks, droplets containing the bacteria are released into the air and a healthy person inhales those droplets and get infected. Then there can be three cases if person inhale tuberculosis bacteria. Then first case, the bacteria completely eliminated by the body's immune system. In second case, which is the latent infection, the bacteria reaches the lung and reside in the alveoli and activate immune response, as a result of which alveolar macrophages engulf bacteria, but bacteria does not get killed because it releases certain chemicals and proteins that inhibit the fusion of lysosome and phagosome, and then it get multiplied, which provokes cell-mediated immunity, and T and B cells surround the macrophage and releases cytokinins and form a hard structure called granuloma. Latent TB does not have symptoms and it is not contagious, and only about 10% of latent infection progress to active disease. And in the third case, when immune system is unable to defend against Mycobacterium tuberculosis infection, the bacteria can escape from granuloma and spread to other area of lung and causes lesions known as Gone complex. Gone complex retain viable bacteria, making them source of long-term infection, which may reactivate, trigger secondary tuberculosis later in life. TB can be classified into pulmonary and extrapulmonary TB. If Mycobacterium tuberculosis affect lung, then it is pulmonary TB, and if it affect organs other than lung, then it is extrapulmonary TB. And symptoms include cough that lasts more than 3 weeks, chest pain, coughing with bloody sputum, shortness of breath, night sweats, malaise, urine discoloration, cloudy and reddish urine, fever with chills, loss of appetite, fatigue. Diagnosis can be done by bacteriological test, sputum culture test, radiography or chest X-ray, nucleic acid amplification, tuberculin skin test, and other biological examinations. Preventive measures include BCG vaccine, use of mask, regular medical follow-up, isolation of patient, ventilation, natural sunlight, UV germicidal irradiation. Following are the drugs used in combination for treating tuberculosis: rifampicin, isoniazid, pyrazinamide, ethambutol. Then these drugs are supplied free to patients through government hospital and health center, and it is monitored under the revised National TB Control Program based on directly observed treatment short course, that is DOTS, and the treatment lasts for minimum period of 9 months. Part 2 is dietary management. So high calorie, high protein and high fluid soft diet is recommended. 45 to 50 kilocalories of energy per kg of body weight can be given to adults. 90 kilocalories of energy per kg of body weight can be given to children. And Medium chain triglyceride and emulsified fats should be preferred. Then drug isoniazid interferes with vitamin D metabolism, which in turn decreases the absorption of calcium and phosphorus. So calcium should be provided liberally. And if there has been any hemorrhage, then iron needs may also increased. Then vitamins are very essential. So vitamin A is should be given. Vitamin C is essential for many regenerative purposes. Pyridoxal phosphate or vitamin B6 is essential to prevent neuritis. And foods you should take in restricted quantity or avoid include high fiber food like whole grain cereals, whole wheat flour, and whole pulses, all raw vegetables and fruits except papaya and banana, fried fatty foods, chemical irritants such as condiment, spices, pickles, chutney, etc. should be avoided. Food should be included are milk and milk based beverages, low fiber foods providing proteins of high biological value, example egg, milk, meat, fish, etc. Plenty of fluids like juices and soups, plain gelatin based desserts, sugars, honey, jams. Thank you.